Hi there. So today I'm going to be discharging a patient. The patient is a 53-year-old male. His name is Bill. He was admitted for a hypertensive emergency. He presented to the ED with elevated BP, dyspnea, and chest pain. He stated that when he took his BP at home, it was 248/150. He felt fatigued, dizzy, and he had a headache. The patient came in with altered level of consciousness and stated that his last 3 cardiologist appointments have been canceled and moved and not rescheduled. While in the ED, the patient had an ECG, chest x-ray, and CT of the brain. All the results were normal and there was no evidence of hemorrhage or fluid accumulation. They were able to gradually reduce his BP and control it to a manageable level, and were able to admit him to high-level care. He has a history of hypertension, TIA, asthma, hyperlipidemia, MI, arrhythmia, arthritis, conversion disorder, peptic ulcer disease, GERD, coronary artery disease, trigeminal neuralgia, and esophageal strictures. The healthcare provider believes that the main cause of this can contribute to medication compliance as well as the patient's conversion disorder, which can cause physical symptoms to suggest a medical condition that are not explained by any other condition. So education on proper medication compliance will be important for this patient. Bill is here with his fiancée Luna, so let's go meet them and get them ready for discharge. Good morning, Bill. Good morning, Luna. How are you guys today?
We're good.
Good. I'm going to be giving you some discharge information to get you out of here today. Is that okay?
Yeah, that's okay.
Perfect. So, first things first, do you know what a hypertensive emergency is?
I do not.
Do you know what hypertension is?
I do.
Okay. Well, a hypertensive emergency is severe high blood pressure, and it can cause organ damage. And that is not very good, as you know. It's mostly due to poorly controlled hypertension and non-compliance with your medication. Now, have you been compliant with your medication?
I thought I was being compliant.
Okay, well, have you been taking it regularly?
Sometimes I forget.
Okay, well, it's okay to forget sometimes. Whoa, Luna is very intrigued with you today.
She's being very affectionate.
Well, it's important to keep medication taking regularly. So we're going to educate you on the medications that you are going to be discharged on, okay?
Okay.
Okay. So, the first medication is Toprol, XL, or metoprolol. Have you ever heard of that?
I think I've had that one before.
Okay. So, you're going to be discharged on 50 milligrams PO, and you're going to take that daily. That is a beta blocker or an antihypertensive, and you're being prescribed that to decrease your blood pressure. Some side effects that you may or may not experience are pulmonary edema, which is some fluid on your lungs, which is very rare. Some erectile dysfunction, which don't worry about, which we can control that. Luna should not have anything to worry about, okay? Some fatigue and weakness, some hypotension, which is low BP. So if you experience any of that, it's important to let your provider know, and we can get that under control. You may need some medication adjustment. Monitor your blood pressure and pulse very frequently. I'm going to actually teach you how to take your pulse, and if you have a home blood pressure monitor, that would be very important to use. And if your pulse is less than 50, you should not take your medication. If you should take this with meals, or you can take it after eating. You should take it at the same time every day, and change position slowly. Maybe get up with maybe your legs dangling off the bed first, and ease your way from sitting to standing, just to prevent that orthostatic hypotension. How should you take this medication? What time should you take this medication?
With meals.
Correct. And how should you change positions?
Slowly.
Correct. Good. Okay. The next medication that you'll be discharged on is hydrochlorothiazide or Urozide. Have you ever heard of that?
No.
Okay. And you'll be on 25 milligrams by mouth 2 times a day. And this is also antihypertensive, and it's a diuretic, and it's ordered to lower your blood pressure, and it's to decrease your extra fluid in your blood vessels. So with hypertension, you have a little bit of extra pressure that causes your blood pressure to increase. So this will take off the extra fluid that is in your blood vessels that are causing, all the increased pressure. Some side effects that can occur are weakness, some hypotension like I discussed with your previous medication. So it's also important to monitor your blood pressure, to assess for any abnormal skin rashes. You want to take this in the morning along with your other medications. Change positions slowly again. Use sunscreen and wear protective clothing to prevent any photosensitivity reactions. What time should you take this medication?
Morning.
Correct. Okay. So do you have any questions so far?
I don't think so.
Okay, so the next medication is Diovan or Valsartan. Have you heard of that?
I have not.
Okay. So the dosage you're going to be on is 320 milligrams PO daily. This is also an antihypertensive, as your main issue is your hypertensive. And this is to lower your blood pressure again. It can possibly cause you dizziness, angioedema, which is some swelling in your face, and it can cause hyperkalemia, which is high potassium. So you're going to want to monitor your labs. You're going to get frequent blood draws. It can cause fatigue, which you're kind of already aware of because you've had it frequently. You want to assess your blood pressure and pulse frequently. Take this as directed at the same time every day, and you can take this with or without food. And also avoid sudden position changes to decrease the orthostatic hypotension. So with this one, why is this med ordered for you?
To help with my hypertension.
Correct. And what is angioedema?
That's swelling in the face.
Correct. And why is it important to take as directed?
To not cause fluctuations in my blood pressure?
Yes. Perfect. Okay. So the next one is Tegretol or carbamazepine. Do you know what that is?
No.
Okay. So this one, you're prescribed 300 milligrams by mouth 2 times a day. And it's anticonvulsant, which don't want to scare you. It is for your trigeminal neuralgia pain. And it can cause some flu-like symptoms, which is called Stevens-Johnson syndrome. And it can also cause some skin reactions, some fever, rash. It can also cause some low platelet counts, ataxia, which is decreased coordination. If you have any of those symptoms, it's important to notify your provider so they can kind of adjust your medication accordingly. It's also very important to monitor any changes in your behavior, and it's also important for Luna to monitor those, because if you have any suicidal ideation or depression going on, it's very important to let someone know or let a family member know to seek help and get that under control before anything. It's also important to administer this medication with food to minimize the gastric upset that it can cause, and to take this, you can also give this at bedtime to avoid the daytime drowsiness that it can occur. And It can sometimes cause easy bruising and petechiae, which is just spotted bruising on your arms and anywhere else, and can cause abdominal pain and sometimes can cause dark urine. So definitely notify your provider if any of that occurs. So with this one, when should you take this medication?
At bedtime to avoid the drowsiness.
Perfect. Okay, so the last med is Lyrica or pregabalin, and your dosage is 25 milligrams by mouth 2 times a day. And this is also anticonvulsant, but is for your neuropathic pain. Some side effects that can occur are peripheral edema, which is some swelling around your legs, your ankles.
So I'm gonna have fat ankles.
It is a possibility to have some swelling, but not everyone it occurs to.
Okay.
It's not the end of the world. Okay. It can cause some dry mouth, some flu-like symptoms. Definitely notify your provider if any of that happens, because it's important to, always keep the providers in the loop with any signs and symptoms that you're having. Notify your provider of any suicidal thoughts or behaviors, dizziness, respiratory depression, which is just decrease in, shortness of breath, difficulty breathing. You can take this medication with or without food. Don't discontinue. Take missed doses as soon as you remember, but don't take it if your next dose is an hour away, because that would possibly cause an overdose, or it can possibly cause edema and weight gain. So if you don't want to gain weight, may not be the best option for you, because I know some people are very self-conscious about that, and it can cause some negative thoughts for some people. So definitely alert your provider if that is not something that you are interested in. And yes, avoid alcohol and opioids. Because it can depress your respiratory system. It can cause shortness of breath. It can cause so definitely don't drink alcohol. Don't take opioids. And if you have a surgery and they prescribe opioids, alert them that you are on the Lyrica. So, okay. So, what happens if you miss a dose?
Take it as soon as I remember, unless it's close to my other dose.
Correct. Good.
Then I'll get fat.
Yes, okay. What should you avoid?
Alcohol and opioids.
Correct. Good job. Okay. Okay, now, for your activity after discharge, you could resume your normal activity, but you shouldn't just jump right back into your job or your, everyday normal activities. You should gradually increase your activity and not overwork yourself, because you did have a hypertensive emergency, which is, a super high blood pressure, and you don't want to overdo yourself. It is important to gradually increase your workload and not overdo it too quickly. You should monitor your signs and symptoms and report to the ER if you have chest pain, shortness of breath, back pain, any seizure-like symptoms, moderate to severe headaches like you had prior to admittance, any weakness in your facial muscles, trouble speaking, drowsiness, confusion, blurred vision, nausea, vomiting. So any symptoms that kind of mimic a heart attack or MI, you should not wait. You should call an ambulance or report to the ER. And also, you should, if you have a blood pressure measurement at home that is higher than 180/20, that you should be concerned of, and you should go to the emergency room. Okay? Okay. And if you have any concerns that you don't feel like are like an emergency, you should call your primary care provider, call your cardiologist, or anyone that like you are in close contact with. But definitely follow up after this with your primary care provider and your cardiologist for sure. Okay? Okay. Okay, so I'm going to teach you how to do your blood pressure and your pulse.
Okay.
Manually. Okay. So, for your pulse, you can do it two different ways. You can do it for 1 minute, and that's, you can count your pulse for 1 minute, and that's your pulse. Or you can count for 15 seconds and multiply that number by 4, and that's your pulse. Does that make sense?
Yes.
Okay, so use 2 fingers, and you can find your pulse right here. Did you find it?
No.
Okay, let me see. Did you find it? Can be tricky to find.
I just don't have one, I guess.
I know, it sometimes seems like that. They can be tricky to find sometimes. Here, let me find it first on you, and then I'll point you in the right direction. Right here.
Okay, I found it.
Okay, so now that you found it, you can count count for 15 seconds, and then multiply by 4. Okay?
Okay.
Okay, so I'll set a timer for 15 seconds. Okay, ready?
Mm-hmm.
What did you get?
17.
Okay, so multiply that by 4. 68. So that is your pulse. Okay?
Okay.
So then you would do that for 1 minute, and that would be your pulse.
Okay.
Okay. Prior to taking your toprol is very important, because if your pulse is less than 50, then you should not take that medication. Okay? Now, as far as your diet on discharge, what is your typical normal diet?
I like hot dogs.
Well, hot dogs are not the best for you in this situation and high blood pressure.
Ridiculous.
Hot dogs are very high in salt. So, we want you to follow this diet called a DASH diet. Have you ever heard that?
No.
Okay, so a DASH diet is a diet rich in fruits, vegetables, and it's low-fat dairy. How do you feel about that?
That sounds lame.
Okay. So they also recommend reducing your saturated and total fat, and a sodium intake of less than 2 grams. And they want to aim for sodium reduction of 2,000 milligrams per day and a potassium intake of 3,500 to 500 milligrams per day. So some foods that are included can be apples, apricots, bananas, broccoli, carrots, so fruits and vegetables, whole grains, potatoes.
I like potatoes.
You like
Can they be
potatoes?
mashed potatoes?
Yeah.
What about with gravy? And lots of butter.
We could have it in reduced amounts.
Whatever.
I know it's going to be a hard adjustment, but it'll be worth it in the end when we're healthy, right?
I guess.
Okay. We'll work on it, okay? Okay. So, we're going to limit canned, dried, packaged, and fast foods. I know. We all love that McDonald's and Chick-fil-A.
Oh, I love Chick-fil-A.
Yeah, I know. I love Chick-fil-A too. And we want to keep a healthy weight and exercise. We want to exercise about 30 minutes a day, 5 days a week. That's doable, right?
I guess.
Luna will exercise with you.
Where is she? She's probably sleeping. But she's not.
Okay, so we're going to start an exercise program. We're going to do walking, gardening, swimming. What are things you like to do?
Watch Netflix.
Well, how about we walk and watch Netflix? That's a compromise.
Sure. I
Okay.
guess.
Okay. How
I'll
about
try it.
Okay. We'll try it. That's an improvement. Okay. Limit alcohol and caffeine. 2 per day.
Of each?
No. Just two. Okay, we want to control our stress. Relaxation techniques. Deep breathing, yoga, meditation. Talk therapy, exercise. We stress exercise.
Okay, fine.
Okay. Do we have any questions?
Can I go home?
We need you to sign some papers first. But yes. Does Luna have any questions?
Luna.
Luna,
Oh,
come on. We have any questions?
come here, Luna.
Does Luna have any questions? No.
Give me my wife back. Do you have questions? No, she just
No.
wants me to go home too.
Okay, yeah. We'll get you out of here. All right, well, I guess we'll get you right out of here. Thank you. I hope you keep healthy and stay on the right track.
I'm gonna try.
Well, thank you, Luna.